Welcome to a PreventConnect podcast, where we explore the prevention of violence against women. This is a project of the California Coalition Against Sexual Assault.
Hi, this is David Lee from PreventConnect.
Hi there.
Hi, and I'm really pleased to be joined with Larry Cohen from Prevention Institute. Hey, Larry. And also Lisa Parks from Prevention Institute. And it was 10 years ago that the three of us, along with a few others, were on the very first PreventConnect web conference. That was March 17th, 2005. It's amazing how fast 10 years has gone.
Yes, I remember at that point expressing some doubts to you, David, about the technology itself and whether web conferences would be a way to really reach people. And I've been so amazed by what we've been able to accomplish.
You know, 10 years ago, we were one of the first people that were doing web conferences, and our first, before the first one, we had a test, which was a disaster. None of the technology worked, and we've been there. And what I've been amazed at in the last 10 years is to see how much a PreventConnect audience has grown. And now we have thousands of people around the country who wait for each web conference. And in the 10 years, I've really been proud that our key partner has been Prevention Institute and the really important work that you've done before and continue to do. And so that's where we started, where we were bringing in public health concepts and other concepts like movement making to think, applying to how do we advance primary prevention for violence against women. So, you know, Lisa, I know that you got involved. This was really a perfect timing for you.
It really was. I had worked at a rape crisis center, a local center, and left to go to public health school with the explicit goal that I wanted to learn how to address these issues at the community level, that if we were going to make any significant headway in reducing these issues, that it had to be done at a broader scale and have more impact. And so it turned out I needed to work while I was going to school, and I landed a job here at Prevention Institute, and I
Lucky for us.
couldn't have been more thrilled to be doing exactly what I set out to do. So it was a really exciting time of a lot of learning, I think, happening personally as well as collectively across public health, as well as the broader sexual and domestic violence movement.
Well, I think of both of you actually as being great teachers in this field, and that we've really been able to learn. And Lisa, while back at Prevention Institute now, actually took a wonderful detour with the California Partnership to End Domestic Violence, and at the partnership working on their Delta project doing primary prevention around intimate partner violence. And Larry, and I've probably known you for over 20 years.
Yes.
You have always been talking about how we can put prevention to the center of our work, and I think PreventConnect has been a great way for us to illustrate this work.
Well, we have to put prevention at the center of the work, because if we don't put prevention at the center of the work, even if we help one individual at a time, there's just going to be a constant onslaught. And it's only when we step back and say, what are the changes we can make? And when I first started working in prevention, I felt like prevention was really trivialized. It was about brochures, it was about health fairs. Prevention meant information, or sometimes prevention meant really after the fact, that it wasn't really primary prevention at all. It was screening. It was looking at what could be done earlier to help people who already were at serious risk. What we know and what we've seen in lots of different fields is that it's when we work comprehensively, when we focus on changing the environment, and that's why our tool, the spectrum prevention, which I see is behind us, that's why the spectrum prevention has been so essential. And what we were able to do with PreventConnect is take learnings from other work we had done, whether it was injury prevention or tobacco prevention, more linear, perhaps easier prevention issues, though all called impossible at the time, and take those learnings and really say, how do we apply that when we're talking about sexual violence, domestic violence, violence against women? And what's been really great about it is that PreventConnect, in effect, has been a praxis, because it's not just us taking the information, but it's having the community kind of absorb, push back, modify, put to use, critique, strengthen. And so it's been basically a cauldron of really advancing a primary prevention field and a primary prevention community. And that's, to me, what's really been special about PreventConnect, and far more than I expected when I said, oh, this technology is not going to work.
Well, it surprised me, and I always thought there was going to be a few hundred people that we were going to reach, and that was going to be the cap. And yet we've grown so much broader, and so many more people have been involved. And we've had the opportunity to get funding from the Ms. Foundation for Women to expand to looking at child sexual abuse prevention. And we're looking at other ways now as we look at sexual assault on college campuses, and we look at other issues that we can be able to address with PreventConnect. So, Lisa, what are some of the things that you think we've learned over the last 10, that have changed in the last 10 years?
It's a really good question. I think that the discussion about changing the environment and the need to look at norms, the need to address issues through policy and practice change, a comprehensive effort, I've seen those concepts become more embedded in funding programs, strategy at the national level, the state level, the local level. It's become incorporated into the dialogue. There's more of a range of vocabulary of bringing the feminist movement-based work and the public health work together, discussion about equity, looking at social determinants of health. There's been much more of an integration and a blending and advancing that work in practice in a range of different kinds of communities.
Yeah, go ahead, Larry.
Well, I also think that that it's played out, everything that Lisa just described has been played out in a partnership with people who are involved in day-to-day work after the fact, and people who understand how critical it is to help every single person who's suffering, so that the wisdom of, wait a minute, what are the underlying factors, emerges from the intimate knowledge that can only come from practitioners, and the knowledge base that we bring from the Prevention Institute perspective of how to shape comprehensive approaches, how to shape community environment, how to focus on equity, is responsive to and needs to be integrated with the very realities of day-to-day experience and what the causal factors are. And I think one which we've really seen tremendous progress in has been the way in which the media as a communicator of norms is starting to shift. And, we're seeing people now being pushed off the air for inappropriate statements. We're seeing people suspended in sports for inappropriate activities, where 10 years ago when we started, that wouldn't have been the case. And I'd like to think that the PreventConnect community has really contributed to that. And it really has been this interplay of the prevention thinking that we bring and the practice, and the not only the practice, but the incredible commitment of the PreventConnect community to make a difference in individual lives and to make a difference in community values. That has really been one of the key factors in making that happen.
Thank you for listening to this PreventConnect podcast. PreventConnect is a project of the California Coalition Against Sexual Assault, with funding from the Centers for Disease Control and Prevention. The views presented on PreventConnect are not necessarily the views of the United States government, the CDC, or CalCASA. To learn more about PreventConnect, visit www.preventconnect.org. For more information about CalCASA's mission or to show your support, visit calcasa.org. That's CALCASA.org.